Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Pediatric growth, short stature. In short stature, the standing height of the child is less than 2 standard deviation or less than third percentile for age and gender. Short stature can be of two types, physiological short stature and pathological short stature. In physiological short stature, there is normal growth velocity. In pathological short stature, the growth velocity is decreased. In physiological short stature, there are of two types. One, familial short stature or genetic short stature. Second, constitutional delay. In familial short stature or genetic short stature, the final height is always short and the parents are also short. Initially at birth, the child is normal in the first 2 years of age. That is, the initially at birth the child is normal, but in the first 2 years of age the growth of the child is less than normal. Then after 2 years of age, the child growth becomes normal. So puberty in short stature occurs on time, and bone age evaluation can be done, and bone age evaluation will be equal to the actual age evaluation in familial short stature or genetic short stature. Second, constitutional delay. In constitutional delay, final height attained is normal and parent's height is not a cause of constitutional delay. Constitutional delay is the most common type of short stature. In constitutional delay, the puberty is delayed and the bone age is less than the actual age of the patient. In constitution, here normally the bone age is calculated based on the ossifying centers of the X-ray. So if the height is less than the bone age equals to actual age, that is the actual age or chronological age is equal to bone age, but the height age is less than the bone age, then that is familial short stature. If height age is equal to the bone age, but this is less than the actual age due to the constitutional delay, so that means this is constitutional delay of short stature.
thank you and thank you for watching.